Yo, what's up YouTube, it's Sadistic Jordan. We're back again with another medicine study video. Man, you already know how it is. Be sure to like the video, subscribe, and if you're here to learn, man, grab your pen, grab your notepad, and this is what we gotta do, man. So, yeah, the first kind of module of second year is about the ear, and I'm still learning about the ear. Man, I'm learning about the ears, man. The anatomy of... Okay, Jordan, you can take your hands off your ear now. What you doing, man? What you doing? You ain't gotta hold your ear like that. Okay, I digress.
A few moments later.
We're learning about the ear, okay? And yeah, I'm gonna be going through the outer ear, middle ear, and inner ear. And as I learn, I'm gonna be showing diagrams on the screen and all of that. Okay, so let me just get my notes up. We're gonna go through this. So, let me write this down. The first part, so when we think about the outer ear, we think about the auricle. Okay, and the auricle, so that's basically made of elastic cartilage structures that basically helps to collect and funnel sound waves into the external acoustic meatus. Okay, so that is your auricle. So that basically the whole ear, all of that is your auricle, and it's made of elastic cartilage. Well, the most part of your outer ear. The part of your ear which is kind of soft and fleshy, that's called your lobule, and that is the inferior aspect of your ear, and it's commonly pierced. So when you get like an ear pierced, you get on your lobule, okay? The next aspect I want to talk about is your tragus. And your tragus is a small cartilaginous projection anterior to the external acoustic meatus. So the external acoustic meatus is basically the opening in your ear, and the tragus just sits anterior to that, and it basically protects the opening of your external acoustic meatus. So if you have the tragus, we actually also have the antitragus, and in the diagram you can see that it's just opposite to the tragus, and it's connected to your lobule, and it forms part of your inferior auricle. Okay, the next aspect I want to talk about of your outer ear is your helix, and your helix is basically the outer curved rim of your auricle. And like the tragus having the antitragus, you also have the antihelix, okay? And that's basically just the inner curved ridge, which is parallel to the helix, okay? And that basically helps shape your upper auricle. And finally, your external acoustic meatus, that's basically the canal, which is leading the sound waves from the auricle to the tympanic membrane, okay? So that's like the outer ear. So just running through it again, you have your auricle, you have your lobule, you have your tragus, antitragus, helix, antihelix, and your external acoustic meatus. And you also have your concha. So your concha is basically a depression in the auricle which leads to the external acoustic meatus. So it kind of acts like a funnel for the sound waves to travel in to get to your external acoustic meatus. Man, let's get on to the middle ear. Okay, so now moving to the middle ear, you have your tympanic membrane, which is also known as your eardrum. And this is like a thin membrane that vibrates in response to sound waves. And it separates the outer ear and the inner ear. The next is your ossicles. So your ossicles are middle ear structures, and they are tiny bones which help to transmit the sound waves, all right? I don't know what, Jordan? Man, I gotta make learning fun, man. This is what it's about. So the first ossicle is the malleus, and it's like a hammer. So when you think of malleus, I want you to think of Thor's hammer, because it's shaped like a hammer, okay? So that's the first ossicle, and that's attached to the tympanic membrane, and that helps to transmit vibrations to the next ossicle. And the next ossicle is your incus, which has an anvil shape, and that's gonna help transfer vibrations from your malleus to the stapes, which is your smallest ossicle and your third ossicle. And that basically is going to transmit vibrations to the oval window of the inner ear. Okay, so as you can see, we're like moving our way to the inner ear. The next structure I want to talk about is your Eustachian tube, which is also called your auditory tube. That basically connects the middle ear to the nasopharynx. And the whole purpose of that is to equalize air pressure. So your Eustachian tube is very important, and it is a middle ear structure. Going through this from the top, you have your tympanic membrane, also known as your eardrum. You have your malleus, which is the hammer, Thor's hammer. incus, think about anvil. And your stapes, think about, I wrote down stirrup. I don't even know what that means. One sec. Stirrup, what is stirrup? Oh, okay. It actually looks like it looks like a stirrup. So that's a supportive loop or frame, usually paired, that hangs from a saddle and provides a footrest for a rider. Okay. So you can see how each of the ossicles, kind of what it looks like. The malleus looks like a hammer, incus looks like an anvil, stapes looks like a stirrup. Alright, we also have the oval window, and that's basically a membrane which is covering, you know, where the stapes transmits vibrations into the inner ear. And yeah, you have your Eustachian tube as well. Okay, so that is the middle ear, and we're going to move on to the inner ear. Let's first start off with the cochlea, and that's a spiral shaped organ which contains receptors for hearing. So when you think cochlea, think about hearing. All right, and you also have your scala vestibuli, and that is actually the upper chamber of your cochlea, and it's filled with perilymph. What is perilymph? Let me search it up. What actually is perilymph? Perilymph. Okay, so perilymph is a fluid found in the inner ear, especially within the scala tympani and scala vestibuli of the cochlea. So yeah, we said that the scala vestibuli was the upper chamber of the cochlea, filled with perilymph, which receives vibrations from the oval window, and your scala tympani is the lower chamber of the cochlea, and that's also filled with perilymph, and that connects to the round window. The perilymph actually has a similar composition to the cerebral spinal fluid, and it's high in sodium. So perilymph plays a crucial role in hearing by transmitting sound vibrations and maintaining the proper fluid balance within the inner ear. That's what perilymph's about. So we did the scala vestibuli and scala tympani. They're basically chambers of the cochlea. The cochlea is a spiral shaped organ which is basically gonna sense hearing. The next is your vestibule. Vestibule? Yeah, your vestibule. Vestibule? Vestibule or vestibule? I'm sorry, man. I ain't got the pronunciation right. I don't know. But the vestibule is the central chamber of the inner ear, and it contains something called your utricle and your saccule, and that's basically involved in balance. So when you think about vestibule, think about balance. All right, think about your stability. Next part is your semicircular canals, and they're basically 3 loop tubes in an X, Y, and Z orientation. All right, orientation. And they basically detect rotational movements for balance. The next inner ear structure is your internal acoustic meatus. And we know that from before, we had an external acoustic meatus. One note to take down, the external acoustic meatus and the internal acoustic meatus are not continuous. So if I was to run like a Q-tip through the external acoustic meatus, I wouldn't get to the internal acoustic meatus. Alright? Okay, so the internal acoustic meatus is an opening into the temporal bone, and that's basically gonna provide passage for your cranial nerve 7 and cranial nerve 8. Cranial nerve 7 being your facial nerve, and cranial nerve 8 being your vestibular cochlear nerve. And now that we're talking about cranial nerves, the facial nerve passes through the internal acoustic meatus, and it's gonna supply muscles of facial expression. Okay? Yeah. So if you're angry, happy, sad,
A few moments later.
The facial nerve is going to be controlling all of that. Alright? And that's cranial nerve 7. Cranial nerve 8 is your vestibular cochlear nerve. And in the name, vestibular cochlear. Let's break it down. Alright? We already know that you have your cochlea, which is the inner ear structure, and that's to do with hearing. And your vestibular is another inner ear structure, and that's to do with balance. So your vestibular cochlear nerve passes through the internal acoustic meatus to the cochlea for hearing and the vestibular for balance. All right, that's what we're talking about, man. Finally, let's talk about some of the key features of the temporal bone. The first one we'll talk about is your styloid process. Styloid meaning pen. So this is like a pen-like pointed projection, which is basically acts as an attachment for the tongue and some neck muscles and ligaments. All right. The next one, a key feature of your temporal bone, is your mastoid process, and that's a large blunt-like projection behind the ear. So you can feel your mastoid bone. If you actually take your fingers and you just go behind your ear, you should feel like a blunt bone right there. That also acts as an attachment for neck muscles. You also have your mandibular fossa, and that's a depression on the inferior surface of your temporal bone, and that articulates with the mandibular condyle forming your temporal mandibular joint. Next part, you have your zygomatic process, and that's a bony projection extending anteriorly, and it forms part of the zygomatic arch. I actually have some more notes on this. Let me just get this up because I wanted to know more on the where is it? The zygomatic. There we go. Yeah, so the zygomatic arch is also known as a cheekbone. I think that's my cheekbone anyway. Yeah, and it basically describes the extension of the zygomatic bone, which articulates with the temporal bone, vice versa, to create the arch, the zygomatic arch, okay? So, we're on to now the petrous portion of the temporal bone, and that's a dense part of your temporal bone, and that's going to enclose and protect the cochlea and semicircular canals, which are inner ear structures. Man, what you doing, Jordan, man? I just want to know why we burp, you know? Why do we burp? That might be a next video. Okay, I digress. Last key structure is your jugular fossa, and that's a depression that forms part of the jugular foramen, and that's going to allow passage. Jordan, man, what you doing, man? What you doing, man? That's going to allow passage. Oh, I did it again. That's going to allow passage for your internal jugular vein. We got there, man. We got there. Okay. I think there's another key aspect of your temporal bone. Oh, yeah, I have another diagram here. Yeah, so I'm going to get that diagram up. And you have something called the squamous part of the temporal bone. And that's a thin, scale-like, flattened section located at the anterior superior aspect of the temporal bone. What does that mean? Anterior means at the front. Superior means above. All right, so that's the front, above section of the temporal bone. All right, and it also helps form the lateral part of the middle cranial fossa. And yeah, we spoke about the petrous part, but I just have some more additional notes here. It's dense, it's a pyramid-shaped section located at the base of the skull, and it houses the inner ear structures. Fun note, it's wedged between the sphenoid bone and the occipital bones, and it plays a crucial role in hearing and balance, okay? You also have your sigmoid sinus, and that's basically a paired dural venous sinus within the skull, and it's characterized by its S shape, okay? So when you see an S shape in the skull, don't know why I'm doing that, think about the sigmoid sinus, okay? And that basically plays a crucial role in draining venous blood from the brain, all right? And specifically, it's going to receive blood from the transverse sinus, and it's going to course inferiorly along the skull base. I might make a separate video on the sinuses and the venous, all of that. All right. The next part of the temporal bone, you have your carotid canal, and that's basically a bony passage located within the petrous part of the temporal bone, and it's going to allow passage for your internal carotid artery to pass from the neck to the cranial cavity. And we really spoke about the internal acoustic meatus, but it's also known as the internal auditory canal, and it's a bony passage within the temporal bone that connects the inner ear to the posterior cranial fossa, and it serves as a conduit. I like that word. Conduit seems so that it's a cool word. Yeah, it's a conduit for the vestibular cochlear nerve, cranial nerve 8, and the facial nerve, cranial nerve 7. And I think that is all of the key structures I have written down. Let me just check. Okay, so this section of the video, I'm going to talk about how is this important clinically, like what we're learning about. So I'm going to talk about mastoiditis, all right? And that's basically inflammation of a portion of the temporal bone referred to as the mastoid air cells. You might ask, what are mastoid air cells? I've got my notes right here. So they're basically epithelium-lined bone septations. I don't know what septations mean. Let me search that up. Septations. Septations. Oh, so they're thin wall-like structures that divide a cavity or structure into smaller compartments. So those mastoid air cells are epithelium-lined bones which kind of divide the cavity into smaller compartments that are continuous with the middle ear cavity. And mastoiditis, anything that ends in itis, think about inflammation, all right? So I'm gonna have a diagram pop up on the screen. What I'll do as well, I'm gonna attach questions you can do. This is me revising. I'm just capturing the content right now. I'm just capturing the moment. But yeah, that's mastoiditis. So that it basically affects the mastoid bone behind the ear. Mastoid meaning the bone behind the ear, itis, inflammation. Put it together, inflammation of the mastoid bone. Oh yeah. When we think about the temporomandibular joint now, on clinical examination, what's involved? I'm gonna tell you. So it's basically an assessment of the jaw joint surrounding the muscles for pain, clicking, or limited movement. You're going to be feeling for any tenderness at the temporal mandibular joint area, the muscles of mastication, all right? And even I think in second year, once we start, we'll probably do this because, yeah, we haven't done this yet. So I'm guessing once we start second year and we have a clinical skills session, we're going to be doing this. But yeah, you're going to be assessing like the range of motion, seeing the patient's ability to open and close their mouth, as well as move their jaw. That's actually kind of cool. I haven't done that in so long, you know. let me finish this. Okay, but yeah, you can look it on imaging, x-rays, CT scans, MRIs to help visualize the TMJ, temporal mandibular joint, look for any surrounding structures. That is the video. To wrap up, the outer ear, funnel sound, the middle ear, transfer sound, and the inner ear, detect sound and balance. Because we have the cochlea and vestibule. All of that is protected by the temporal bone. And there's some key structures of the temporal bone we need to know, all right? So yeah, be sure to pause, rewind the video, and try to recall the structures yourself. And you can even like label a blank diagram as practice. But if this helped, be sure to like, subscribe. Let's keep learning medicine together. Oh yeah. But yeah, uni starts in about a month time. I'm excited and I'm doing preparation for it. And yeah, this is me revising and I'm just capturing the moment right now. So yeah, I'm gonna be sure to include some notes down below and some questions for you to try. And yeah, I'll see you all in the next YouTube video. Solistic Jordan, peace.